So Bob's a general paediatrician at Imperial, and I've known Bob for many years through our times together at the London School of Paediatrics. So Bob's very committed to education. He's also Director of Strategy at Imperial, leading for strategy, innovation and research. And I think many of you will know of Bob through his work through Connecting Care for Children, which is a really important and in its day was groundbreaking, but now fortunately lots of other organisations are doing similar pieces of work. But Connecting Care for Children, as you know, is an integrated child health programme in North West London, and I'm sure Bob will be drawing on some of his experiences from that in his talk this morning. Crucially also, Bob is leading a global movement on kindness in healthcare, involving now over 1,000 people from over 30 different countries. So I think with that background, I'm absolutely delighted to welcome Bob and really looking forward to your talk, which is called Leading for Kindness in Healthcare. Thanks, Bob.
Thank you very much, Camilla, and it's just completely wonderful to be here and amongst friends and fellow paediatricians. And as Camilla alluded to, sort of work and life and career has sort of headed off into all sorts of different directions and sometimes sort of pulled away from children and young people in a very busy exec role at Imperial and doing all sorts of other things, but I'm very much a paediatrician still at heart, and advocacy for children and young people right at the heart of it. So fantastic to hear that starting video that really reminds us why we're all here. It's an absolute privilege to be asked to do this, and Peter Lackman and I were just talking about how a small number of years ago the chance of having a talk like this right up front as a plenary on a day of a scientific conference was zero. And it's a happy sign of a changing world that we're really focused on that. And it's not lost on me, the focus on mental health today, hearing a little bit about the fantastic 3 presentations and abstracts that you've got to follow me. I think there's some really, really useful threads in on this. So listen, I'm going to try and canter through in sort of 25, 30 minutes some thoughts and some thinking that has emerged and developed around kindness. I was sat chatting to a medical student about 2 years ago on this, and they sort of scratched their chin and they sort of said, look, this is a bit of a side hustle for you, isn't it, this kindness stuff? And I sort of leant back and said, well, actually, it's increasingly becoming the main hustle and really at the heart of what healthcare needs to be about. So any of you who are sitting here thinking, okay, this will be a nice gentle start to the morning and I'll just sort of, get myself going after a nice Scottish breakfast, this is going to be pretty hard-edged. We're going to get into some really difficult and heavy thinking and work. And I'm going to try and give you a bit of time to reflect and talk to your neighbours a little bit as well. And I hope, if I'm successful in this talk, that it triggers you to think about things throughout the day and on your train or plane home and back in the workplace too. So I'm a big one for storytelling and learning how to get better at storytelling. And the wonderful Gabby, he's sat up front, and I and some others were recently doing a workshop at a different conference around storytelling. And I think, for me, the real master of this is this guy here who's called Marshall Gantz, G-A-N-Z, Marshall Gantz, who, look him up, he's done a lot of work around public narrative. And in its essence is a very, very simple 3 words. And they are self, us, and now. And the key to this is understanding that a really good story comes from you putting yourself out there a little bit. Telling people a little bit about what you stand for, about what matters to you. We started with what children and young people matter. The second bit is us, is how does that connect in with you? So my job here, quite hard to see you all with the lights, but there's 1,000 or so people here. How can I connect with as many of you as possible? And the now bit is about urgency. So Marshall Gantz will cut his teeth doing work with unions and Californian farmers and in the in the work around race discrimination in the US in the 60s, and really start work with Barack Obama about his approach to community organising and getting voted. So when I talk, I hope will see a little bit about that self and us and now in that. So, starting with self, the point about self is to not tell you in a very boring way about the different things that I've done in my career. It's deeply unexciting, but much more important about what do I stand for. And without doubt, I was brought up with a sort of focus on, I think, best described as be kind and be helpful. And in a room full of paediatricians, I suspect almost all of us in this room had an essence of that from our family, from our education. Now, rather wonderfully, it feels like I'm coming home for many, many reasons. One of them is hanging out with a bunch of paediatricians. But the other reason is Glasgow. So 4 years ago, pretty much to the day, 29th of March 2019, I was sat here in Glasgow listening to a completely amazing paediatrician, way more eminent than me, Don Berwick, and Maureen Bigziano, talk about a whole host of issues and opportunities in healthcare. And they had a single slide up about kindness, basic acts of kindness. And I'll come to the detail of this a bit later in my talk because it's really interesting work. And I sat back in my chair thinking about a long-standing interest and focus on teams and on leadership and on kindness. But I realized that I'd got this wrong. I'd framed things in just a slightly weak way. I'd said, look, I know it's really soft and fluffy, but it's important. So I'd start by being apologetic and then try and argue why this was important. And 4 and a bit years ago was a sort of real pivot moment for me for saying, we need to reframe this. It has to be the starting point. It has to be the business end. You can't have a conversation about safety or about inclusion or about equity or about money, which has dominated the NHS for the last 10, 15 years, unless you get this right. It's a precondition for those conversations. And in essence, this talk is going to focus on exactly that. So really simply, this conversation is really about how we improve quality. This was Don Berwick's work 22 years ago with others, the 6 domains of quality. I'd really recommend have this in your back pocket whenever you want. It's amazing, isn't it? There's equity, somewhat buried for 20 years, that we've now got a real focus on. So this conversation here is about quality. So, as Camilla mentioned, I'm really interested in how people learn, how I learn, and what I've tried to do in the next 5 to 10 minutes is have a bit of a canter through some of the theory, some of the practical experience, some of the evidence around kindness and healthcare. And I hope that different bits of this might appeal to different people. We learn in different ways. And I'm also going to highlight the work of a whole load of other people with a few good book references and the likes that you might want to get stuck into and go and read. So I suspect quite a few of you in this room might have come across this book called Intelligent Kindness. And it's got a second edition out with a very different cover. And is written by a fabulous chap who I've got to know very well, John Ballot and Penny Campling. And in a sense, this was the first documentation that I've seen that described this cycle, really starting with kinship. So if you start at about 8, 9 o'clock on this cycle and start to explore, and in the book they explore this idea around kinship and how that promotes kindness, that leads to people tuning into each other a bit more. That builds trust, which generates a therapeutic alliance and leads to better outcomes. So you can take that through a doctor-patient or clinician-patient angle, or you can take it through a colleague-colleague angle. But right at its heart is building trust, building relationships. Camilla mentioned Connecting Care for Children. Our single intervention in and around that work, around integrated care, was building trust between colleagues in primary care and secondary care. So something really interesting about this. So Intelligent Kindness, really thin book, but full of great riches. This is even shorter. This is a 30-page policy document that was generated not very far from here from a wonderful organisation called the Carnegie UK Trust. And with a name like that, they would have to be based up in Scotland. And Julia Unwin did this really important work. Now, quite a few of you looking around have been on team schools with me, and you'll know this sits on my wall. sort of above my shoulder, way more interesting than looking at me, but look at this behind me. And Julia Unwin did some really important work looking at kindness, emotion, and human relationships in public policy. And she came up with this diagram and this concept that's really important, and I think a lot of you will find this really useful. And you know, almost having this up on your wall or on the table, you can refer so many conversations to it. So her observation was the healthcare systems, health and care systems in this country, immediately post the Mid-Staffordshire inquiry, focused for very good reason on this rational lexicon. So we were incredibly worried about safety and on making sure care was fair and transparent. And so a lot of focus came in on scrutiny, on thinking about value for money. A lot came in around targets and boundaries and this desire for evidence and data and accountability, all really good and important things. But I think there's quite a strong argument, and Julia makes this beautifully in this paper, that we've over-focused on that. And we've forgotten about this relational lexicon here, which is really about trying to find connection, about bringing out the value of individuals, something about hope, which feels really important at the moment. And some of the tools around that are a focus on things like well-being, building of friendships, of relationships, the role of storytelling. Some risks with it, absolutely, but the outcomes are around building relationships, building trust, and actually having some real challenge within it. So what Julia's argument is you need to have this wonderful balance of the rational and the relational. And without doubt, speaking about the NHS in England that I know very well, is we've got that balance really, really wrong in the last decade, and we need to refine that. So really lovely bit from those of you who are into public policy. Right, the guys who like a bit of evidence, this chap, Len Berry, is an absolute superstar, and it's well worth looking up his papers, and they're freely available with great ease. And he, working across the States, has done some really interesting work in cancer care. And in essence, he has evidenced that kinder care leads to better outcomes in patients with cancer. So that's a sort of lovely mic drop moment for people who sort of think this stuff is soft and fluffy. And what I love about this particular paper was he and his team codified what do they mean by kindness? What do kind behaviours actually look like? And those of you quite like a sort of a recipe, check these 6 out. So whenever I do this talk and think about this, I sort of give myself a mental score out of 10 for each of these 6. None of them is 10 out of 10. All of them I can get better on. And I'd sort of challenge all of you in the room to think about this. And the first one that no single person in this room is 10 out of 10 on, and that is deep listening. So I'm really, really convinced that we can all get much, much better at listening. And the more work we've done around kindness, the more we realise the importance of listening here. And personally, things like extroversion and being full of ideas are things that get in the way of good listening. The mobile phone massively gets in the way of good listening. So anyone who thinks they can send an email or check TikTok out whilst listening, you can't. So, deep listening. When you're next listening to somebody, a colleague or a patient, just ask yourself mentally, am I really, really listening? Am I really deeply listening? Something about clear empathy, I suspect people in this room are very good about this. I love the language in this third one, generous acts of discretionary effort that go beyond what patients and families expect. This beautiful bit about timely care that reduces stress and anxiety. I was talking to a group of surgeons on Monday and reminding them that those little phone calls that come from theatres back up to the parents and carers that many of us are sitting watching around an empty bed space while their child is missing down in theatres or recovery or somewhere. Just to say, 10-second call to say the operation all went as planned. I'll come up and see you on the ward a bit later. Just game-changing, brief conversation that reduces stress and anxiety. Gentle honesty in discussions and conversations. When I was first learning paediatrics in the 90s, we were definitely pushed away from honesty, this worry around litigation. Thankfully, healthcare has become much, much more open. much more full of candour. But I love that phrase, gentle honesty, and thoughtful support for families and carers. So really, really critical work, hard evidence that this makes a real difference. This wonderful work, lots of you will know, Michael West, working with my great friend and collaborator on this work, Susie Bailey at the King's Fund, has done an awful lot around compassionate leadership. He's worked around what makes a great team for about the last 30 years, and right at its heart is this idea of compassionate leadership. And look, some of these concepts are here again: attending, paying attention to staff, listening with fascination. Not Michael's phrase. Nancy Klein, in the wonderful book Time to Think, talks about listening with fascination. What a great phrase. Understanding, a shared understanding of what people face. There's something about walking next to people. I'm increasingly convinced you can't walk in someone else's shoes, but you can walk next to people and listen and do your best to understand. Empathizing, and that beautiful word about helping. Here's a definition of helping: taking intelligent action to serve or help. Feels really key to who we are, what we should be about. And this is a great book written by two American physicians. They've done a really good job of pulling together the evidence behind compassion. So again, just something to look at if you want more on this. But I just want to finish off on this really, really critical concept of psychological safety. So two quick bits of story here. The first bit is Google and Project Aristotle. So Google, one of the biggest and most commercial organizations on the planet, were really interested in what makes highly performing teams, okay, for deeply commercial reasons. They spent a lot of money doing the sort of research project all of us would dream about having the funding to do. 2 years of it, they looked at a couple of hundred teams, about 40,000 employees. A lot of expensive research, ethnography, qualitative research. And these were the top 5 things that made a difference to high-performing teams. So the first bit was impact. Can team members see that the work they're doing makes a difference? So those of us who work clinically, you see it in front of you. But what about the guys who work in the back office, who work in finance, who work in HR? How do we connect them with that? Meaning, work needs to be personally important for people, for team members. Work needs to have structure and clarity, no surprise around that. And there's something about dependability of different members of the team. But absolutely top of the list by a complete country mile was this idea of psychological safety. Team members feel safe to take risks and be vulnerable in front of each other. So this started to get me thinking about what's the role of an attending consultant on the ward. I used to think, when I first started this about 13 years ago, that I was there for my sort of expert paediatric knowledge. Thankfully for me and everyone else around, with that a little in short supply, I realised that wasn't the key commodity. Because I'm surrounded by these amazing people. Amazing so-called junior doctors, not very junior. Fantastic nurses. Paediatrics, we have these incredible multidisciplinary teams. Pharmacists. These amazing people called parents and carers and young people. So surely my job is to try and create an environment where people can thrive. So next time you're in a clinic or in theatres or in your intensive care unit or on a ward round, just think about your role as a leader to try and create some psychological safety for people. Can you be really sure that the student nurse on their very, very first day of that placement could say to you, I might be wrong, but I have a little feeling that we might have given that medicine to that child already? Could they really say that to you? Do you create enough safety around the way you work? And it's hard, and looking older and having consultant on your badge or registrar or whatever makes things difficult. You've really got to actively work on that and keep working on that. But psychological safety is really key. And the global guru on this is a wonderful Amy Edmondson, worth looking up her work. And she, more generally than healthcare, but has done a lot around psychological safety in the workplace. So that is a little bit about the evidence and the practice. I'm going to touch a bit of, I guess, my thinking around this, around leadership, because that was the ask and the brief around this talk. So I've only told this story something like 943 times, if I keep this right. But and many of you will know it, but it's got to be one of the best stories. I still don't know if it's true or not. But so the story goes, in the very early 60s, 1962, the Americans are spending an insane amount of money on the space race. And JF Kennedy, the president, goes to NASA and meets the commander and meets the various astronauts, and then is wandering down a corridor and bumps into a man with a broom. What the Americans call a janitor, we would call a cleaner. And I guess if you're president, you should be good at a bit of chit-chat and says, well, you know, what are you doing here? And the cleaner, the janitor, points up and says, I'm helping put a man on the moon. So the guy cleaning the corridor is really clear that he is contributing to putting a man on the moon, which then happens 7 years later. Mission, purpose, meaning. So I love that story, and it really gets to right at the heart of what mission and purpose mean. And I think, wow, the moon, and it's an amazing aspiration, and it's very measurable. You either get there or you don't. And then to think, hang on, we've got an even greater mission and purpose and meaning in healthcare. Think back to when you were 15, 16, 17, I don't know, something like that sort of age. Why did you go into healthcare? My suspicion is you had a really, really clear mission and purpose and meaning to why you did. And I guess one of the things that worries me is we seem to have lost a lot of that. So I think, talking about leadership, our collective leadership challenge is to reconnect healthcare with its mission and its purpose. And I think there's a really important link with how we behave and how we look after each other in the context of kindness. And if we get time, I'll tell you about this photo a little bit later. So, a little bit of thinking. This is a scientific forum. You want to put some sort of ideas out, things. I guess where my thinking is on this, and not just my thinking, some wonderful colleagues who've helped shape this, is if you have a real clarity of mission and purpose, people working in healthcare will have a greater sense of purpose and meaning in their work and more joy in their work. If there's an environment that is more kind, that's more psychologically safe, people will enjoy their work more, but also will give greater compassion and understanding and empathy to each other and to the patients they serve. And that, as people like Len Berry have shown us, that will lead to improved patient and population outcomes. I said up front, this was a talk about quality. So kindness and reconnecting with our mission will improve patient and population outcomes. Just a little moment on this as a bit of sharing, really. And when I joined Imperial back about 13 years ago as a consultant, the reason I went there was because of the wonderful children's department at St Mary's, and it still is a really wonderful learning and nurturing place. But I didn't join because of the organisation. It quite frankly had a really poor culture, was, I think, an organisation somewhat short of direction, certainly short on humility and the desire to learn. Thankfully, over the last 7 or 8 years, we've done a huge amount of work to really start to try and change that. And that's a long old journey, and a journey that continues. But one of the important bits of work we did about 7 years ago was some co-design work with staff to say what really matters around here. And 4 things came up as being the key things. And the most important piece came up was kind. We had really interesting debates at the time about kind versus compassion. Some staff were anxious about the word compassion and sort of found it difficult to think about being compassionate to other staff members. They could see that with patients, and a discussion for another day. But the key bit here was codifying. What do we mean by kind behaviours? So I wasn't behind this work at all because I actually thought this was crazy. Why on earth do you need to write this stuff down? Thankfully, other people cleverer and wiser than me suggested that we really did. And so we published this behaviours framework. And if you look on the Trust website, you can get hold of this if it's useful. And again, this was done through co-design. And these are some examples of some of the behaviours that we expect to see. But on the left-hand side, things that we love to see. And really clearly and specifically, things that we don't want to see. And what a lot of people have said is they found this framework really helpful for driving conversations, one-to-one conversations about behaviour. And certainly, compared to the organisation I joined, to the one I'm in now, there are many, many more conversations about behaviour. So just to finish off, I want to tell you a little bit about our conversation for kindness. So when I was sat in Glasgow 4 years ago and having that moment of thinking, I need to get harder and tougher about this, need to be much stronger around the thinking about it, I started to chat to people in the next door seat to me, and people I knew through different improvement networks, and more people said, you're onto something here, count me in. And a little group of us put together a workshop plan for a big conference called the International Forum for Quality and Safety in Healthcare. And a few of us in this room are very involved in that conference and have continued to beat the drum around this. And we put this in, and it was accepted to run a workshop which was meant to be in Copenhagen in 2020. COVID came along and got in the way of that, so we ended up running a virtual workshop in November 2020. And in the planning for that, a group of 7 of us met consecutively in August, September and October on the 3rd Thursday of the month. 7 of us having a conversation, planning this workshop that we ran virtually. And in the October meeting, I remember the conversation, it went like this: what outcomes do we want from that workshop? And in a sort of very unthought through way, I sort of said, look, I've just loved meeting with you and kicking this around and developing our thinking about it. Why don't we just keep meeting, but open it out and see if anyone else joins? And that was really what we did, and we decided that would be a good plan. So we ran this workshop in November, virtually, about 100 people, and we just put out the invite to come and join it. And as Camilla mentioned, it has really gone absolutely crazy. So we meet monthly, 3rd Thursday of the month, between 6 and 7. The focus is on listening, on learning, on thinking differently, and mobilising for action. And perhaps in brackets it should say sort of recharging one's batteries around hope and a desire to change things. There's a really wonderful culture around sharing of resources, energy and ideas, and we have some ridiculously senior and experienced people who've done sort of global healthcare work, and we have some people on their early days of careers in healthcare, and every one of us in between, and a real culture. And the sessions are facilitated and convened by this group here, including Gabby, who's sat up at the front here now. And as Camilla mentioned, we've now got about 1,100 contributors from 32 countries. And definitely bits of the world we haven't yet tuned into. There's a particularly crazy group in Australia and New Zealand. It was lovely to wander down the corridors here trying to find this hall, bumping into a fellow paediatrician from Perth in Australia who's here with us today. But the Australians and Kiwis get up at 3 o'clock in the morning and 5 o'clock in the morning to join this call. I try and send them to bed at the beginning every time, but they ignore us. So, penultimate slide, and a really important bit of learning, and I promised you some sort of heavy stuff, and it's going to come now. So 31 months into the conversation, these are some of the key themes that have emerged. And there's some stuff in here that's worth some really deep thought. So the first bit is that kindness is a choice of action. So we choose to be kind, or therefore not kind. It is an action, it is a behaviour. So the idea, we absolutely all have good days and bad days, and that's important context. But how you behave is your choice. It's something you have control over. So there's a real opportunity for us to role model and lead for this. Without doubt, leading with kindness needs to be very central in work to reduce staff burnout, to create more inclusive workplaces. We're touching on today's theme around mental health. Kind behaviours and leadership around kindness is really critical around that. As I've touched on, and there's a whole load of stuff I didn't go through, there's a growing evidence base of the biological and psychological impact of kindness. And amongst that community of about 1,100 people, we've got some really interesting researchers who are doing work in on that space. Kind behaviours are as effective as any action in creating psychological safety at work. So we've relatively recently been having some really interesting conversations with Amy Edmondson around this. And I think there's lots of excitement around this idea because people understand the Len Berry work around codifying what kind behaviours mean, and that link to psychological safety that people like Google have shown us is critical to highly performing teams is key. Systematically challenging unkind behaviours, and importantly exploring why, is a crucial role of leaders. So we'll come to this a little bit later, but what are you prepared to walk past? So I have a really clear phrase in my mind, in my head, that I don't care how important you think you are, I'll take you on around this stuff. Now, I'm a 6'3" white man who's a doctor, who's an executive at a big trust. If I can't get tough and feisty about that, how on earth can we expect many other people who feel much less included in our health and care system to? So what I'd really invite you to do around that is think about how could you go one level up from what you would have walked past yesterday? How can you just get a little bit tougher around it? And the learning that I've had around this, and why I've put that little piece in brackets about exploring why, is almost always unkind behaviours come from people's own issues, own worries, often self-esteem issues. So I think there's a sort of two-level approach to it. The first level is absolute clarity and challenge that somebody's behaviour is not acceptable. Okay, I will often use the phrase that is neither kind nor helpful. So absolute clarity that a behaviour is not acceptable. And then a completely different tack. What's going on? This is really unlike you. Normally, you're a really lovely, kind, thoughtful person. What's going on? And inevitably, if you can create that space, the openness and the tears and the reflection come in around difficulties at work, difficulties at home, worries, anxiety, worry about a relative. And there's lots of interventions that can come into place. So if we're serious about changing healthcare, we need to be really tough on behaviour, and we need to be really supportive for people who are able to reflect and think about how their behaviour changes. Think Dominic Raab. Who would have thought a story on kindness would be? So those of you who don't know the UK politics very well, Dominic Raab was a very senior politician, emphasis on the word was, who was outed for unkind behaviours. He would be here defending himself, saying, yeah, but I care about outcomes and I want the best for the population. I'm a high-achieving, demanding person. Okay, this confusion that you can't have accountability with kindness is total nonsense. None of the teams who work with me have any confusion at all about what they're accountable for. It does not mean you have to behave in an unkind way. And he had to resign as a senior member of the cabinet because of his behaviours. To me, it's a real tipping point, and I think we need to be talking about that. We have people working as senior leaders in our healthcare who, when I think of Dominic Raab, I think of them. That game has to be over. We have to people need to change or they need to go. So, I promised you some hard stuff. Let's go into a little moment of philosophy. What is more important, kind intent or the outcome of kindness? So those of you who like some really good thought experiments, I've got no idea what the answer to that is, but you might want to give that some thought. And then, perhaps some more hopeful things on the bottom row. Kindness is a cycle. Being kind stimulates more kindness. So have a go at this. I'm an improver at heart and love a PDSA cycle of little plan something, do something, see what happens. So try it today. Try and do something kind. Say a little thank you to somebody who you wouldn't have done normally. Go and find somebody. This idea that small acts of kindness can have a really big impact. You just don't know what is going on in someone else's life at that moment in time. And often those small acts of kindness, if they ignite with somebody at a particular time where they're feeling low about something or worried about something, it can make a huge difference. So, final pitch is if you do one thing, make kindness your starting point, and everything else will follow. Now, people look at me and think you're absolutely crazy. Why on earth would you put your email address up to a room full of 1,200 people or something? But it's there. If you want to be part of this community, please get in touch. I think I saw Anna Baverstock sort of hidden away in the middle as well, as a fellow paediatrician who's been very involved in this work and done lots of stuff with us with college tutors. But please come and get in touch. You'll meet a rather amazing community of people. And for you guys in the UK, 6 o'clock on a Thursday is not the most terrible of time. For my new Australian friend, apologies for that. So what does this mean in practice? I'm going to leave you with some final questions to think about and perhaps just a moment of reflection, and you might want to have a minute's conversation with your next door neighbour. So what am I going to do? And when I say I, okay, I'm reading this for myself, but I want you to all read this. This is I, you. What am I going to do to increase the focus on kindness and to reconnect myself, the idea around self-care, and my colleagues with the real mission in healthcare? How do I get back to feeling like I did when I was 16? When I see unkind behaviours, what am I prepared to walk past and ignore? How do I take that up a notch? That confidence and feeling there's a whole bunch of us around who are with you. How do you stay on the right side of the argument around that? And then in a more asset-based piece, what are the kindness always events that I can promote in my leadership of high quality, safe, equitable care? So I'm going to leave you to have a little reflect on that. Why don't you have a quick conversation with your next door neighbour? That might just give Emma and Camilla a chance to have a little look at what's coming in on questions on the chat. So have a little reflect, those of you who like to have a moment's peace. If not, a chance for the talkers in the room like me to have a natter to your next door neighbour. Have a little think about these 3 questions, and then we'll come back to a final question or 2 before we get on to the next session.
Is there anything more?
Just sit here, then it's safe.
Yeah, sit with us. Yeah.
So pull them back in.
Yeah.
All right, everybody. Sounds like some really great discussions going on, and I think what a challenge to us all. We've got time for just a couple of questions before we need to move on. So, Bob, the first question that's come in that we're going to say, and this is a bit of a theme for a few of the questions actually, a perceived reason for not being kind is being too busy, especially with the kind of increasing waiting lists, demands on clinics. Is there any evidence in the healthcare setting that this is true, or is this just a perception?
Thank you. And just looking through, it sounds like this is a big one for people. It's undoubtedly true. The pressures on people, on all of us, are absolutely huge. I may be a little bit annoying here, and I'm sort of stuck behind the desk, so as the tomatoes come flying in, I can duck. But I think part of the reason of framing this around leadership, so those of you who know me well and things, I have a phrase that goes along the lines of too busy isn't really a phrase. It's about prioritization. And I think the leadership ask here is we have to prioritise this. So I got in a wonderful argument on Friday with an academic professor at Imperial College who kept talking about the system this and the system, and I was like, we are the system, we're people. And he sort of said the problem is doctors don't have time to talk and listen to patients and things. And I think the leadership piece is for us really taking charge on this stuff and really prioritising what is important. That is really hard because it just feels like there's more and more and more stuff. So one of the answers that we've got to have much more grown-up debate about is, what are we going to stop doing? So my wonderful friend and colleague who was here 4 years ago doing that talk, Maureen Bigziano, talks about exnovation. So the opposite of innovation, what do you add in? But I think we've got to have many, many more conversations, and that's a really important one. I mean, there's some interesting stuff in the policy world. You know, governments talk about it all the time, don't they? Less targets and things. But definitely a leadership role, how I see it, is your broad shoulders, or that umbrella, is about trying to give people the space. So back to my attending consultant bit, how do I try and create the space for the guys around me who are brilliant to thrive? So when people are getting very stressed about all the patients waiting in ED, how do you sort of sprinkle some calm around that and just slow it all down a bit? So I think this is really about leadership and about priority. But if we're saying this is really important, this leads to quality, this leads to equity, this leads to greater safety, well, of course you'd prioritise it. So I think we've just got to talk that up, talk less about money. Money's important, but it's a tail, it's not a dog, it's not the main thing.
Thank you. And I think we just have time for one more. So the other question was, how should you respond when you're told to be kind when staff raise an issue about individuals who are being rude or racist?
Okay, so amazing, thank you, and what an amazing question. I'm anxious when I hear the idea of being told to be kind. Anyone who has children will know that that isn't a very clever phrase to say to your 3-year-old or 4-year-old or 17-year-old or the like. So there's something about leading for kind of environments, telling people to be kind, I think is a ridiculous setup. It sounds like inherent in this conversation, in this question, a sort of failure to recognise what the real issue is around inclusion, around racism. We have significant problems in our society that I think, shamefully have been ignored, and I think a huge amount has come out through COVID that has helped a lot of us who had somewhat let that agenda drift past, get more and more focused on it. I think we've seen at Imperial, it's been really interesting, Tim, my CEO, and I've talked quite a lot about the weaponization of values, where people they'll sort of write a letter to the CEO complaining about such and such didn't adhere to the trust values, sort of really missing the point around this stuff. This is about a fundamental culture of behaviour. So reading that question and thinking about it, it feels like the root of the problem is a team or department or organisational culture that isn't really open and inclusive to addressing the issues that are there. Remember my piece that kindness is a choice and an action. It's a tool almost that you can use in that space. So I think leadership is really key. The use of the finding of allies, I think, is really critical. And then the only other thing I'd say is we've had some success with things like the sort of active bystander type approaches to things. So how do you coach and support people to just, I was talking about going one level higher than you were before. But I think, look, there's a very, very long journey on this. And my sort of final remark would be, I've got no idea what I'm going to do in the next 20 years, but I know that this will be the number one thing I'm focused on.
Thank you so much.
Brilliant. Thank you.